I'm Dr. Teh, Chiek. I'm a neurologist in Damansara Specialist Hospital 2 here. I graduated in University Putra, Malaysia in year 2008. After that, I started my service in Hospital Tuanku Jaafar Seremban for my internship training, and I obtained my specialist in 2013 with the MRCP UK. Subsequently, I developed a bit of interest of neurology, and I pursue further for my subspecialty training under the Ministry of Health, and so continue my career. I go on to study in Hospital Kuala Lumpur, followed by HUKM, and finally I have the 1-year subspecialty training in neurology, particularly on the movement disorder and Parkinson disease in the Hospital for Neurology and Neurosurgeon in UK, Queen Square, under my professor, a very well-known figure in our world, Prof. Kailash Bhatia. I came back here in 2019 and continued serving in government hospital from 2019 until I joined Damansara Specialist Hospital 2 in 2023. DSH2 established since 21st of May 2023. I chose this hospital mainly because I used to be only neurologist in the state of Negeri Sembilan, so I set up the things. I prefer here because I can start everything from the scratch. I can set the protocol myself, all those things. So on day one itself, we label it as a comprehensive stroke center. There's a meaning of comprehensive stroke center here. Well, meaning we are treating the stroke one-stop center. Starting from the beginning, patient come to our doorstep until we discharge with the meaningful recovery from our hospital. So Comprehensive Stroke Center, one of the things now is about hyperacute stroke services. We are running 24/7 stroke services. This is called a thrombolysis or thrombectomy. Of course, this is not one-man show. This is including a collaboration. I'm very fortunate I have a very good expert team in my colleague in the radiology department, emergency department, neurosurgery, including the rehabilitation, and also my very important allied healthcare, my nurses, occupational therapists, and speech therapists as well. So all these things come together. We work hand in hand together to achieve the patient outcome. Remember, I think the patient center is what our motto is over here. So what makes us different, of course, as being a new hospital. Of course, our imaging example, our MRI is state of the art. As compared to the other hospitals, some of them, we are having the highest resolution. We call it 3T Tesla, a MRI scan which is able to detect even more smaller stroke, so we can intervene. We do have other things like advanced imaging, for example, a CT perfusion scan, or this is a 3D reconstruction of blood vessel in the brain, and that's very important for us to intervene further. So in order to catch the time, we always say time is brain. We want to catch the time as soon as possible to improve the outcome of the patient at our best level. Quite a large number of our patients is coming from international. One of it is from Indonesia. Our patient, I still remember very well. This is younger, 20 plus years old. While waiting to fly back to Indonesia, in one of the night time, I think it's about 11 or 12, patients suddenly became confused. Remember, this is a younger, 20 plus years, suddenly confused, unable to move one side, paralyzed on one side while trying to go into a toilet. So because they're staying in one of the hotel nearby, they were immediately to send back to us. So I saw the patient, I received a call from the emergency department in the middle of the night. So we came straight away to assess the patient. Indeed, he developed something called a ischemic stroke, meaning to say it's a blood clot in the brain on one of the blood vessels. He's being confused, completely not moving one side of the body, and we decided after the brief discussion, we take the time very swiftly. We went in straight away for what we call a thrombectomy. Simple procedure. What we do is we went in through minimal invasive, not open surgery. We go into the vessels, up to the brain. We just pull out the blood clot, and the patient have a very meaningful recovery on the next day. When he was eventually discharged about day 3 of admissions, be able to walk back to normal. This is fascinating. This is what I think, not me alone, I think every single of a neurologist who is doing stroke, this is what we are looking for. So it's very satisfying. We know if this patient without such treatment available, this patient may end up to be in ICU or even to be putting on the ventilator, intubator, may even succumb to death due to this, to the disease itself.